My name's Zach. I'm 28 at the moment, and I use a personal health budget. This is my personal assistant, Jemma.
I've been a PA for Zach for about 8 years, and I'm employed directly through the personal health budget.
So, personal health budgets, PHBs, work by allocating an amount of money to someone based on their needs, and this includes the care, so wages for carers, physiotherapy costs, and training costs for carers. And the way my personal health budget works is I have access to a bank account which I pay carers directly, and carers are employed by me directly. They're not self-employed. Everyone's employed by me as if I was a company. Prior to having the personal health budget or PHB, my parents were the ones that would take on the majority of my care needs. For the first couple of years, I was in and out of hospital a lot, and my parents had to learn very quickly how to do nasopharyngeal suctioning, how to do basic life support, while a lot of their peers were just learning how to change nappies. And as I was getting older, I wanted more independence from them, and more personal autonomy. So what the personal health budget has allowed is them to become more parents to me rather than carers. When I was 16, I had spinal surgery, and having spent a month or so in hospital afterwards, came home to a full package of care, 24/7, and this was entirely agency staff, and what that meant was every week or so I'd have someone new come into my home, someone new that I had to instruct on my routine, my needs, and which put a lot of strain on me at the time. So for me, ironically, my parents fulfilling my care needs was actually preferable because I wasn't having to instruct someone new. What this developed into was being granted the personal health budget at 18.
I think that's one of the key benefits really of the PHB over this traditional care model is you get to employ your own team who you're comfortable with, you're happy with, and we come in to the same place every time. We know what to expect, Zach knows what to expect, and over that long period of time, most of the people that are in our team have been here for years now. We know the job inside and out, we know what to do. It's not, the burden isn't placed on Zach to have to say it all the time, which I think is a unspoken burden that a lot of people who use care packages or disabled people, they have to shoulder that burden, and nobody really recognises that.
So a personal assistant to me is someone that enables me to live the life that I want to lead, and that looks different for different people, but for me it supports the physical functionality in my life. So getting out of bed in the morning, helping me make lunch, supporting all the medical needs that I have in order to have a stable and safe life.
We get training specific to Zach, so anything bespoke or things like that. We have people like St. Luke's come in and they train us on specific things, which means that the team that we have, and we have about 6 or 7 people now, we all are trained specifically for this role, which I think is one of the main benefits of the PHB.
Something it offers is I think something that lacks from a lot of traditional care setups, which is consistency. And the benefit of that for me is consistency in people who are less to me like tools to enable my life, and more people that are very involved in my life, which I want them to be. And aside from this having a lot of emotional benefits, where I feel supported by the people who work for me, rather than just people operating machinery. They feel like quite important parts of my life. It also offers medical consistency. People that understand my condition, understand the signs of when I'm about to be ill, and know what to do if I have signs of a chest infection. So as a result, I don't rely on going into hospital if I'm ill. I have a setup at home where everyone that works with me is very well trained, very familiar with a rare condition like mine, in a way that agency carers just wouldn't be able to be.
And when we talk about things like sustainability of care setups, I think one of the really important things is things like that, avoiding hospital stays, avoiding unnecessary medical intrusion into your life. How many times have we all heard the stories of people going into hospital because of a pressure sore or something so so avoidable, and it can have really catastrophic repercussions in people's lives, something that is so simple and so avoidable as just having consistency of care, consistency of medical, care. So that's another really big benefit.
It's interesting, as someone who has never had any desire to be a manager, to be put in the position of being a manager in order to get out of bed in the morning. And this kind of has its downsides. One of the downsides being learning how to run effectively a company without any of the training that often managers are given for this. Thankfully, there is support available. There's companies that will manage it for you if you prefer. I have a company that does my payroll because I hate working with numbers. So that takes a lot of the strain off. I think while my life, as someone with a long-term condition and someone coming to the end of their life, while our situations are very different, I think fundamentally what we want out of it is the same, which is for the parts of our life where we need support, we want that to be supported in a way that allows us to live the way we want to live. And I think for everyone that looks different. For me, I like my carers to be a core part of my life. Jemma and I are very good friends, and I love that about the personal health budget, that allows that. But for a lot of people, what they want out of care is to have their physical needs support, so help to get out of bed in the morning, and that's it. But that's a very powerful thing for someone coming to the end of their life. If someone has an increased level of need due to a terminal condition, not having to rely on family members for that support can be very liberating.
And for the family as well, having the knowledge that someone that they trust and know is going to come in regularly and take care of it is a really big weight off of a lot of people's shoulders. Whenever you talk to people who are either receiving end-of-life care or to family after they've passed, whenever they talk about what was invaluable, it's having that familiar face, having someone they trust. The ability to be able to structure your day how you want it, with the people you want, is the most important thing, and the PHP definitely allows that.
For me, I think the process has worked fantastically. It's been helpful that my mum's very much an engaged person in managing my care as well, so we kind of run it as a team. But while it's been at times a lot to manage, I think I've got to a point now where I don't think my life could look the way it does under agency care or under care managed by someone other than me. I think one thing that I always like to ask people is for them to look at their own lives and all the intricacies of that, all the things they like to do, all the places they like to go during the week on a Friday night, where they like to wake up on the Saturday morning. I like to look at that and think that if they had a physical need like mine, a need for care like mine, what they would need out of carers to enable their lives to maintain the way it looks now.
When you think about the future of people that have care setups, that you can have a system where you can go out to work, you can have a romantic life, you can travel, you can do all the things that are an integral part of being a human, alongside having your care needs supported. They're not the antithesis of each other. And I think that's something to really consider, particularly if you are going into the healthcare profession in all different capacities, because it is on us then as professionals to be able to facilitate that.